and we'll start talking about one or two surgeries that could be done to correct some one or two abnormalities in children. So the first surgery we are talking about is what is known as a duodenostomy. Okay, are you getting it? Duodenoduodenostomy. So they usually do these surgeries for duodenal atresia. That's when the duodenum is kind of like becoming so small. Okay, so they do a duodenoduodenostomy surgery for this. So let's quickly just talk about what a duodenoduodenostomy surgery is. So background: duodenal atresia is a congenital condition where the duodenum, which is the first part of the small intestine, is becoming so small. So as it becomes so small, it can become blocked, or it can become completely absent over time. Atresia is kind of like something is wearing off. Okay, so newborns will present with bilious vomiting, abdominal distension. You see a double bubble sign, okay, on x-rays. Then associated anomalies is usually linked with things like Down syndrome. The newborn is probably will have a congenital heart disease, then okay, and all of that. So surgical management is that definitive treatment is surgery. That's the surgery that is known as what? The duodenoduodenostomy. All right, so principle, you're actually going to create a bypass around the atretic segment. That's the segment that is becoming so small, okay, by connecting the proximal duodenum to the distal duodenum. So this will now restore. Can you see? I have the picture here where you can see the bypass. Okay, so for the part that is becoming so small, okay, you create the bypass there. I seen it. You create the bypass, you bypass the small size. Okay, so procedure is exploration. So a midline laparotomy is done. They confirm the diagnosis, they also initiate treatment. So the proximal dilated duodenum and the collapsed distal duodenum is actually identified. Okay, the anastomosis, a diamond-shaped duodenostomy is commonly performed. Okay, so the proximal transverse incision and the distal longitudinal incision is sutured together. Okay, so to create a wide tension-free opening. So ensure that there's no kinking, ensure that there's no narrowing. Okay, so closure, abdominal wall layers, of course. Abdominal walls will be closed in layers. That's the abdomen that you actually opened up earlier on. So alternative surgeries include surgeries like duodenodenostomy. The duodenodenostomy is when the distal duodenum is not suitable, so you join it directly to the jejunum. Okay, then we have the duodenoplasty. That one, I think you are basically trying to do a plastic surgery